could you give a definition of what public health really is and why it matters in care?
Yeah, so an easy definition would be that it's anything that's related to your health that's outside of like the healthcare system.
Mm-hmm.
So anything that's outside of the hospital, like outside of primary care doctors, things like making sure that your water is clean is an example of public health and how it matters for your health, right? But that's not like in the hospital or a doctor doing it. It's making sure that our food doesn't have contaminants in it. So like the FDA and things like that, that's part of public health. And also reporting if there's any kinds of like infectious disease spread, you know, in an environment, understanding how to communicate that to all of the people and taking the actions to make sure that more people don't get that disease. So an example was COVID, right? It's a lot of people finally found out what public health was because they were just like, oh, I never really thought about that before because we didn't have anything like that in our memory at least. Yeah.
So in essence, the public health is spends a lot of time safeguarding the public. In essence, right? And a lot of oversight and a lot of safeguards in place that protect us, the general public, from different infections. Right.
Yeah. And when it comes to, you know, caregiving and the applicability of public health to that, you can think of a lot of ways that caregivers kind of need support with health outside of the healthcare system.
Right.
And I gave the example of making sure you have food or respite or things like that. But that's all kind of like healthcare adjacent and would be kind of thought about as public health. You know, public health is also about educating the public widely about what is dementia, for instance.
Right.
Because a lot of people will be like, what's the difference between Alzheimer's disease and dementia? You know, as public health educators or professionals, it's our job to tell people what is the difference because it matters of how you would get treatment for that or how you would prevent further cognitive decline.